A Jenny Chambers-szel készült videósorozatunk utolsó részéhez érkeztünk el. Jennyről most már nagyon sok mindent hallottatok ti is, és láthatjátok, hogy a kutatásban napi szinten részt vesz, habár nem orvos, de olyan információkkal rendelkezik, ami alapján azt gondolom, hogy minden okunk megvan arra, hogy őt kérdezzük a legfontosabb kutatási eredményekről, és azokról a kérdésekről, amit ti is nagyon gyakran feltesztek nekünk a betegséggel kapcsolatban. A legjobb helyről kapjuk ezeket a válaszokat, kérlek, hallgassátok szeretettel ezt a videót is.
I wanted to ask you that could you please summarize in short the most important research findings of your research team from the last couple of years? It's a hard question, I know, and I know that your research group is very active, but I'm very interested in this topic.
I think the biggest finding from the research group that I'm in has been the doctors now have a test that will tell them when the risk of stillbirth comes in for women with cholestasis. So it's all about the bile acids. And we've known for a few years that bile acids help diagnose the condition. And the researchers felt that they did play a part in problems for the baby. And there's been research done by Professor Williamson and others over the years to show this. But what we didn't really know was a good enough concentration at which it became a problem for babies. A few years ago, a researcher called Anna Glantz managed to show that when bile acid concentrations are over 40 micromole per litre, then there were adverse outcomes for the babies. So a risk of meconium staining, that's when they open their bowels in the room, a risk of spontaneous premature birth, a risk of the baby going into distress, but she didn't actually show stillbirth. And Dr. Carolina Vardia was able to do a massive meta-analysis using data from the UK, from the US, from Australia, from all over the world. And in 2019, she was able to publish her results showing that the problem of stillbirth arises when bile acid concentrations go over 100 micromole per litre. And what this meant was just amazing, because it meant immediately that 90% of women could be reassured about the safety of their baby. 90%, that's amazing.
Yes.
It meant also that we knew 10% were going to have bile acids over 100. It meant their risk of stillbirth was going to be 3.44%. So what that means is that doctors can know that this is we need to keep a special eye on this pregnancy. But more importantly, the bile acid test is really the only way to monitor cholestasis. It's the only way to assess safety. It is the most important test that anyone can do for women who have cholestasis. And it's really important that the results come back quickly, so that the doctors can keep a close eye on what those bile acid concentrations are doing, and they know whether that woman can be enabled to perhaps wait until 38, 39 weeks to have her baby, if she can put up with the itching, or whether that baby needs to come earlier than 36 weeks even, because her bile acid concentrations have gone up over 100. And it's not the most expensive test in the world. It isn't. It isn't. It's so simple.
Yes.
And that, to me, is the biggest piece of research. I think it's the most influential piece of research to come out. And it's really the result of many years' work. It's taken a long time to get that data to be able to come out with that paper.
And what the British researchers advise, how often should a pregnant woman with ICP have tests, so blood tests?
Yeah, that's such a good question. Such a good question. And overall, we would say once diagnosed, most women will be diagnosed with the condition around 30 weeks, 32 weeks, most, maybe even a bit later than that. There are women who are diagnosed earlier. So, for example, we know I developed it sort of, in fact, with Tim, I started itching at 24 weeks. And we know there are some women who can be diagnosed with it as early as 7 weeks of pregnancy. But I think once diagnosed, depending on how many weeks you are, weekly tests are probably a good idea. As a charity, we would say up until about 34 weeks, weekly tests are probably okay. And from then on, we would recommend testing twice a week. That's only because bile acids can rise. They don't tend to go suddenly from, say, 10 to 110. However, if you've got somebody whose bile acid concentrations are, say, 70, just want to make sure that they don't go over the 100. So we would recommend twice a week from 33 weeks.
And in Hungary, the medical name which was taken when somebody has ICP is Ursofalk. So
yeah,
it's the same, I think, that you use in Great Britain. So could you tell us how is it work, and is it enough for ICP to manage the symptoms or lower the bile acid measure?
Yeah. So ursodeoxycholic acid.
Yes.
Was introduced into the UK in the early 90s. I was one of the first women to take it. Wow. It was my liver specialist, and there were a few meds that we were going to try, and the first one wasn't really very good at all, and urso was the second choice drug. And urso is a bile acid, and I've just told you that bile acids are the problem for babies, but urso is what we call a good bile acid. It's a non-toxic bile acid. It's a friendly bile acid, and it just makes the bile acid pool overall less toxic. And so when somebody starts urso, what we know from the research is actually the total bile acid concentrations, about 60% of those are going to be urso, which is really good. However, a trial a few years ago called Pitches showed that actually urso didn't reduce bile acids quite as effectively as we thought it was or hoped it was. So it certainly isn't a wonder drug. But the most recent research, again from Dr. Caroline Ovadia, doing another big analysis, is that women whose bile acid concentrations are over 40 micromoles per litre, if they take urso, that tends to reduce their risk of preterm, so that's having your baby before 37 weeks of pregnancy, spontaneous labour. So that's a real positive. And I think also, if you are itching so badly, I don't know about you, Bernie, but I didn't know what to do with myself with the itching. It was just awful. If somebody said, well, we've got this medication and the trial showed it really didn't help itch that much, but it helped it a little bit, I'd take it just to help it a little bit in case it did. Now, it didn't actually do anything for my itch. But I have known women who've taken it who really feel that it's been like a miracle medication for them. So is it the drug for treating ICP? No, but it's still a drug for treating ICP. And certainly we need a much better medication. And the exciting thing is that an American company is trialing one of their medications called volixibat, and they are trialing it in a trial called OHANA. and women are going to be offered this medication in the hope that it's going to reduce their bile acids and going to reduce their itch. And that's just started in the United States, and it's also started in the UK. So that's really, really exciting, but we're not going to know any results from that, oh gosh, for another 2 or 3 years yet.
And what did you think about the diet? So can a pregnant woman with ICP moderate her bile acid level with healthy or yes, a healthy diet or not?
It's a really good question. Nutrition is really, really important in pregnancy. It's really important to eat healthily. There is no special diet that is known to bring bile acids down. It makes sense not to eat foods that your liver doesn't like so much, perhaps. That's a sort of not a great way of putting it, but so perhaps things like saturated fats, chocolate, cakes that you don't really need, maybe cut down on those. Some women feel that when they go for a less fatty diet, it helps their itch. We don't have any studies on this, so there's no medical scientific evidence, but we know from the groups women tell us that if they eat really healthily, cut down on the saturated fats, then they feel that that does help their itch. It would certainly be good to do some research. One thing that women can do, that all pregnant women can do, is to take vitamin D. So there has been some research that showed that vitamin D might be helpful to take in an ICP pregnancy. But as we know that it's really a good vitamin to take, and that most of the population don't have enough vitamin D levels,
yes,
and it can't harm, that's a good vitamin D take, and you can normally get that in your normal pregnancy supplements that you take.
So could we say that a diet cannot help in moderating bile acid level?
I think we don't have any evidence for that at the moment, no.
And my last question is about you, because I know, and many other people know, that you are very, very, very hard worker, and you work very hard for this charity for women who suffer from ICP, and we hope that, so I personally hope that you will follow it as long as you can, but I'm very interested, how did you imagine your future? Would you like to participate in this organization as long as it's possible, or have you any plan which you can help with us?
Well, as I said earlier, I really didn't expect to be doing this work 30 years after my diagnosis. I genuinely thought that once doctors knew about this condition and knew how it could be dangerous for some babies, they'd want to learn more about it. They'd want to do everything they could to prevent it. And I've learned that that's not always the case. It takes a long time sometimes to change medical attitudes to things. I currently run the charity as the CEO, but I also founded the charity. And I think there comes a time where you need to hand your charity over, and you need to pass it on to other people who can grow it and nurture it like you have done. And yes, this charity, of course, is representative of my babies, the babies I have, and they're big babies now, and the babies I don't have. And that's going to be a real emotional wrench for me when I do hand it over, but I think it will be the right thing to do. I will stay connected in some form, definitely. I'd like to keep the research going for a few more years, to be part of the research group if I can, helping them with recruitment, data and studies. I guess I do want to cut down. I am tired.
I believe.
And yeah, so I'm not going to retire as such, but I do want in the next 2 to 3 years to be handing the charity over and cutting down on my work. So I've got a bit of time for me and to do other things.
So thank you so much that you gave so much time for us, and thank you.
Well, I'm going to have a go, but I don't know if I'm going to say this right. So apologies, everybody, if I get this wrong. Köszönöm.
Oh,
Is that
perfect.
okay?
It's perfect. And see ya.
Nagyon köszönöm, hogy meghallgattátok ezt a részt, és kérlek, tartsatok velünk a következőkben is, mert nagyon izgalmas részek következnek.